We're talking about the pharmacology of another drug known as what, the Paromomycin. And this drug is sold under the brand name known as what, Humatin. All right. So looking at the pharmacology, you know what we usually do? We have a lot of pictures of the drug so that you get familiar with how the drug looks like. Then we look at the uses of this drug, like different types of what disease condition that this drug actually has an effect on them. They will look at the available forms, the common side effects, the serious side effects, and important things to note on the drug. Okay, so let's begin. All right. So looking at the pharmacology now, we say that this drug is an antibiotic medication. Now, when you hear antibiotic, simply know that it has an effect on what? Bacteria. Okay, it has an action against bacteria, right? So it's used to treat various infections like what? Intestinal parasitic infections like what? Giardiasis and Cryptosporidiosis. Cryptosporidiosis. It has an effect on what? Amoebiasis, that's intestinal parasite infections, had an effect on disease condition caused by tapeworms. All right, examples: hereditary disease. It also has an effect on what? Leishmaniasis, that's a skin and visceral infection. Then it also has some effect on topical infections. That's infections that will be affecting your skin. All right, like the areas around the, okay, yeah, skin, the eyes, the ear. All right, so talking about how this drug works, that's a mechanism of action. It works by interfering with the protein synthesis in the microorganism. Okay, so you know the microorganisms, they need the protein synthesis to keep being alive and surviving and all that. So it now what? Interfere with the protein synthesis, right? Thereby shortening the lives of the microorganism. Okay, so it can also inhibit cell membrane function. That's the cells of the that's a microorganism. This microorganism is unicellular or multicellular. It will either way act to basically what? Inhibit their cell membrane function. All right. So looking at this now, available forms. This drug is available in the oral tablets or capsules. It's also available in topical creams or ointment. Topical, that means what? The one that you can rub on your skin. Okay. It has injectable solutions. It has eye and ear drops. Right. Common side effects include gastrointestinal upset. That's like the side effect of the drugs. Okay. Patients that are taking this drug, they can be complaining that they want to vomit, or they'll be vomiting. They'll be having diarrhea. All right. They'll be having abdominal pain. They'll be having rashes or itching. Sometimes a rare side effect is hearing loss. Okay, another rare side effect is what? Kidney damage. That's basically when the toxicity of the drug gets so very high. Okay, then serious side effects include allergic reactions, ototoxicity, then nephrotoxicity. We have already spoken about this, right? Then neuromuscular blockade. Okay, so the additions were just neuromuscular blockade and allergic reactions, because here we spoke about two of them being rare. Okay, ototoxicity and nephrotoxicity. All right. So important note is paromycin is not suitable for pregnant or breastfeeding mothers. You should use it with caution in patients with kidney or hearing problems. Do you understand? Because to worsen it. All right. It may also interact with other medications such as what, diuretics and neuromuscular blockers. Right. So I think that's it for the pharmacology of what? Paromomycin, or sold under the brand name known as what? Humatin.